Hi there, and welcome back to the American Society of the University of Haifa's ongoing public health coverage of the COVID-19 pandemic with Dr. Manfred Green, Director of the University of Haifa's International Master's Program in Public Health and Global Health Leadership. After being touted an international model of coronavirus success, Israel now ranks third for the highest daily coronavirus infection rate among European countries, according to the World Health Organization. Today, we'll hear from Dr. Green on where Israel went wrong and how the country's second wave differs from the first. As always, we'll leave a link in this post where you'll be able to learn more about the University of Haifa's ongoing response to COVID-19, and where you'll also be able to find more information on how to support the university during this time. Thank you, and with that, I pass you on to Dr. Green.
Thanks very much, James. I'm going to talk about the second wave as a concept and talk about Israel in specifically, and then we can raise some issues. So globally, just as a recurrent, we now are 12.5 million cases and about 560,000 deaths, and it's increasing all the time. So the virus is spreading, and it's spread all over the world, and it's not stopping its spread. This is basically an epidemic curve of New York, which we would call the first wave. And I'm showing it to show you just how the epidemic developed, and then with very strict interventions, they managed to reduce the number of cases, and it's dropped now to a very low level. And this is Israel now, where you can see on the left the first so-called wave of the epidemic, of the pandemic. And what you're seeing on the right is the increase that started around about the beginning of June, and it's continuing to increase. And the question then is, do we call this a second wave? Is this a continuation of the first? What does this mean? But if anyone looked at this graph, you would clearly say to me, it's obviously a second wave. So what do we mean basically by a second wave? Why do we talk about pandemics occurring in waves? And I guess we very much influenced by the Spanish flu of 1918, 1919. And the Spanish flu, which people now feel that we are seeing again in the form of the coronavirus, of COVID-19, did occur in waves. But these waves don't occur as some kind of magical characteristic of the virus. They occur primarily and probably entirely due to environmental conditions and behavior of the population. So the first wave started around about May in 1918, and it started in the United States. It started to spread, and then we remember that that was when the United States entered the First World War. And then many, many American troops were then shipped off to Europe. And when they arrived in Europe, they started to spread the Spanish flu in Europe. And it was a severe disease. But it was Spanish flu. It was influenza. It was an H1N1, an H1N1 virus, which at the time was not known to be the cause because the influenza virus had not yet been identified. But they knew that this was influenza. At least that's what it was called. There was still partly a belief that it was caused by a bacteria. And but the interventions were very similar to the interventions we were using today. You know, the same kind of almost lockdown: stay at home, wear masks, avoid crowding, more hygiene, the same kind of messages. Why did we see a second wave? Well, the second wave didn't occur by chance, because the second wave basically occurred after soldiers started to come back from this First World War. And they had been infected there. And this was, again, a change in the movement of the population. But there is also a theory, and again, it's not entirely proven because, again, they have to get more information on the virus. And obviously, there are only isolates that were managed to identified in people who had died during the 1918-1919 pandemic. But there is some feeling that there was a mutation in the virus. H1N1, or the influenza viruses, as you know, do mutate, they change. They are RNA viruses that mutate. In other words, they change their form. And it's believed possibly that this was a different, somewhat different virus which had more virulence. It caused more deaths. And that went down, and then again there was an introduction of restrictions, and then again movements of the population, and again we saw a third wave. So all of the waves that you see are actually not something due specifically to the virus, except for the mutation that I mentioned, but largely due to the behavior of the population and the movement of population. The reason why it ended ultimately most probably was that about 30% of the population of the world probably had already been infected by this H1N1 virus. Australia came in towards the end because they'd kept a very strict lockdown, but it eventually infected them. And what you saw then was that the virus didn't disappear, but it became kind of at a very low endemic level. In other words, it was around, but it didn't spread much because the large part of the population were immune. Now, again, remembering that influenza, for a so-called herd immunity, because it doesn't spread as easily as coronavirus, you don't require the same percentage. So 30% or 40% of people immune for influenza would probably provide a good measure of herd immunity. Coronavirus, we believe, we'd need 60, 70, 80% because it spreads more easily and more rapidly. So what we have now is a picture. So let's go back to the reason for the waves and relate it to Israel. Changes in the behavior of the population, movements in the population, mutation of the virus, which is not relevant at the moment for the coronavirus. Although there are people who are talking about the fact that the virus has become less virulent and so on, but you've got to distinguish between less virulent and the ability to spread. There is no evidence that it is not able to spread as efficiently. If it is actually causing more deaths or less deaths, that's another issue, and we can talk about that at another time. At the present time, there may be some indications, but I'm not convinced that there's any change. I think it's largely due to people who are at high risk, who are being more protected, and probably the treatment, or not probably, I'm sure that the treatment is better now that the physicians recognize the disease, know how to handle the patients better, even though there is not very many specific treatments, and there's still obviously no vaccine. And of course, the seasonality of the infections, and that's another issue, because these waves, if it was something inherent in the virus, maybe you would see it all over the world doing this. Well, obviously that's not happening. What's happening, for example, in South Africa, they are very much on the upswing there, and the cases are rapidly increasing. South Africa has now passed Italy and passed Spain, and they are rapidly starting to get to be one of the most infected populations in the world. And as you know, it's now winter, midwinter in South Africa. So why is there a second wave in Israel? Well, this is obviously a nice discussion that we can have, and everybody will give it. One of them obviously is possibly that the lockdown was opened too fast. Remembering that when the number of cases go down, that doesn't mean the virus has gone away. The virus was still there. We didn't get to zero and then stop the lockdown. We actually got to a fairly low level, and then the lockdown was started, and it was actually changed fairly rapidly, allowing big events, and these big events are very problematic. Big weddings, funerals, celebrations, whatever. When you have several hundred people crowding together, not wearing masks, that's a good recipe for a possibility for the virus to spread. You just need a couple of people who are sick there, and they'll start infecting others, and they'll infect others, and so on and so forth. So too many large gatherings, particularly maybe in certain sectors of the population, because we are seeing concentrations still in some of, for example, the ultra-religious communities, and there it's possibly also related to some of this crowding that needs to be, and that obviously needs to be taken care of. A lack of compliance with using masks in closed public places is still, I believe, a major problem in Israel. For some reason, I don't know whether it's not obvious to everyone. People don't believe that they need to wear a mask on their faces, both on their mouths and their nose, specifically, particularly when they're in closed spaces. And that doesn't seem to be happening as it should. They should be as far as possible, maintaining this physical distance. And of course, there's still a problem with contact tracing because they had inadequate professionals or people who were doing contact tracing and actually then being able to sort of interrupt the chain. So basically, I've said this before and I'll go back to it again. What do we need to do? I guess that's the main question. I think people are tired of hearing what was done and where we went wrong and keep saying, well, okay, well, what do we need to do? Well, first of all, we need to get used to a new norm. And I'm going to quote again Anthony Fauci, because I think he's really, we need to listen to it. He's saying the right things at the right time. The head of the National Institute for Infectious Diseases at the NIH. And he said, we have to recognize that it's not public health or the economy. It's public health for the economy. In other words, we need to make sure that we have good health of the population in order for the economy to operate. One of the mistakes I think that people are making in it is saying, if we do these lockdowns, we're going to damage irreparably the economy. But if we don't have these lockdowns and we have widespread of the disease, not only will there be deaths from the disease, which people talk about, but huge amounts of the population will not be at work because they'll be sick, or people will be afraid to go to work because they're cases, or they'll be afraid to send their kids to school. So in fact, you won't be solving a problem by saying, let's open up and we'll get used to having a lot of cases. That's not going to save the economy. The same thing was said, by the way, in the 1989. Would you believe they said exactly the same thing? That if in fact people don't actually keep, stop crowding and so on and so forth, and if we don't manage to stop the spread, that's going to damage the economy because of the absenteeism from work, not just because people will be dying. So that's obvious, and I'm not minimizing the importance of people who are going to die from the disease. That's obviously a very major issue. So what can we do for prevention? I'll summarize now quickly. We need to keep up this physical distancing, and that means avoiding these crowds. Some people are going to be hurt economically for this. We need to support them, but this has to be imposed. This has to be taken account. And if there are cultural issues, people have to realize this is virtually a once-in-a-lifetime situation, and this is the time to do what's right and to physically distance, to get the number of cases down to a manageable level. When I say a manageable level, get it down to less than 10 cases a day, something like that, so that you can start living a normal life. Encourage the use of masks. I say encourage because I see that it's not being done, even though by law it may be there. So try and get the public to understand that using masks is helping the whole population to get this pandemic under control so that we can open up the economy. That's the main issue. And obviously stop people from getting ill. Limit large gatherings. I've said it again and I keep repeating it because I think this is one of the major issues in Israel. And then of course, trace and isolate the contacts. This has to be done quickly. It doesn't have to get to every contact, but it does have to be done quickly and efficiently and try and get them. And of course, the isolation of the contacts could be voluntary isolation. They could be asked to voluntarily isolate themselves. The most important thing is to get to them and know that these are people who are likely to spread it and to get the cooperation of the population. We need very much to get trust and cooperation from the population. And anyone feeling ill should not go to work. That should be emphasized. I'm going to comment at the end now just on one issue. I've mentioned already the voluntary isolation. The treatment and vaccine, I've mentioned before. Obviously, anyone who gets ill has to know that they'll get optimal care. Start to invest heavily in the health system, invest in research, and keep looking for a good vaccine. And go back to normal living, we hope, knowing that there may be an increase of risk in the elderly of sickness, but and try and get it to be something that will be rare, that it's not something that will be common. I'm going to say one last thing because I know my time's running out, but let me just say a little bit about the winter. The winter is going to be problematic, in my opinion, for several reasons. One, obviously, is that the coronavirus, I believe, is going to become more active in the sense it will be more efficient in spreading during the winter time, similar to other respiratory viruses, such as influenza, but there are others, RSV and whatever. So we need to recognize that there is a strong possibility that there's going to be more spread during the winter. We have to recognize that at the schools and at the universities, and also to some extent at the places of work, we're going to have a great difficulty during the winter distinguishing between another intercurrent illness, in other words, somebody who has flu or another virus, and coronavirus. That means, for example, that at a university or at a school, if there's a child in the class who's absent one day because he has a sore throat or a cold or a fever, we won't know what it is. And does that mean then that the whole class goes into isolation? So really what we need to do is emphasize the use of masks. This is going to be critical, because if you have a class of students or a class of pupils and everybody is wearing a mask, maybe not the teacher, because that's a problem, but let's assume that we can accept the fact that the teacher won't, but the kids do and the students do, then at least you know that there's been someone in the class, there's time to check that person, and you don't have to send everybody home and put that whole group into isolation, because this is going to create chaos in itself. I would suggest, the last thing, and I've said it before, let's try and make the school year and the academic year at the universities in such a way that there'll be much less teaching during the height of the winter, basically January, February for us, something around January, and get the semester over as soon as possible so that the teaching is done as much as possible during the warmer months. So that may mean making the university semester start a little bit earlier, and also for the schools to give them a longer vacation in winter and make that up during the summer months. I think these are the things that I'd like to recommend at this time. I think we can handle it if we do it in the right way. Thanks very much.